Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I'm joined this evening by a special guest, Raavi. Raavi, please introduce yourself.
Hi, everyone. My name is Raavi Singh. I am an administrative fellow at Dana Farber up here in Boston, and I'm very excited to be here today.
We're so excited to have you. Dana Farber is a really well known institution, and I think a lot of people will be interested what their fellowship is like. And you've also had a lot of other interesting experiences as well, starting all the way back at the University of South Florida, where you got both an MHA and an MPH. I have to ask, what was the reason for getting both those degrees, and what got you interested in healthcare administration?
Yeah, absolutely. Well, I guess the real answer starts a little bit further back when I did my undergrad. I have a bachelor's in biology. I was in pre med. I thought, what's a good way to kind of help my GPA? Chemistry was really hard. So I did what any normal child does, and I took financial accounting. I realized that, I kind of really liked doing business classes. I continued throughout the 4 years I was there. And when I graduated, I actually had four minors in business and a bachelor's in biology. And so at the same point in time, I was thinking, do I really want to go to medical school? Do I, really want to do business? And I kind of found the Master's of Public Health. I concentrated in health policies and programs. And so I thought it was a really great blend of really my passion for business and my love of healthcare. So I applied to the University of South Florida. I got in for that specific concentration. And while I was there, I learned that there is something else called the Masters of Health Administration, which was an even bigger blend of my passion for healthcare and for business. And so, really combining those two, I had, learned so much about public health and the health disparities that affect so many people around the world that I just thought it was so meaningful to have that degree as well and really be able to incorporate things I learned there with my practice in the business of healthcare.
Nice. That is excellent. I want to ask, I'm getting my MBA right now, and
Mhm.
I've always been a huge fan of MPH degrees and programs. And so I was thinking of doing an MPH as well. Is that something that you would recommend? Do you think that extra knowledge has been really useful for you?
I definitely think so. I think definitely everyone should learn about the social disparities of health that exist within our country. Through my MPH, I also learned a lot about foreign systems of healthcare. So I think it's very important knowledge internationally, but also nationally. So if that's something you're very interested in, if you want to focus on accessibility and quality of care and really health outcomes of different populations, it would be very beneficial to get.
Nice, yeah, because I have been really considering it. So that's one of the reasons I wanted to talk to you is because you're having these two degrees and you're going down this business path here, and so you've had quite a few different roles in a few different organizations. It looks like one of your first internships was at Broward Health. Uh, was that during your undergrad or your grad school, and was it challenging to get that internship? What was the process like?
So that was actually during grad school. So because I did the two degrees instead of doing the traditional 2 years for the master's, I did three. And part of our program was actually to have an internship. I went to school in Tampa, Florida, but I am from Fort Lauderdale. And so Broward Health is the kind of health institute from where I grew up. And so when I was applying for internships, I did the same thing that a lot of my peers did. I looked in the Tampa area. There were so many opportunities. And then I heard about the internship at Broward Health, and I kind of thought, if this is a way that I could go home for the summer, I can spend time with my family, but I can also work in the community that I grew up in and that, I've seen this big name everywhere. Might as well, throw my hat in the ring. And so the application process was pretty average. It was similar to a lot of the application processes. So Broward Health has a very long established internship program. They had maybe about 30 interns the year I was there, and it was run by their chief operating officer. So their internship program was quite robust. They take a lot of interns from undergrad and grad school, and then they kind of place you in the interest area of your choice and also an area of need within the institute. So it was a very cool opportunity.
What was your area of interest?
So I was really interested in like the corporate side of Broward Health. So Broward Health is a corporate system with four main hospitals. I also was really interested in like really nerdy of me in compliance. So I wanted to learn the legality of, healthcare, what's the law involved. You hear about so many different institutions that have, you know, run into trouble with the law or have different interactions with, HIPAA, anti-kickback, Stark law. And so I really wanted to know what was the intersectionality between healthcare business and, the actual government side of healthcare. So I thought that was a phenomenal place for me to be placed in.
Did you ever consider going to law school or having a career in compliance?
I definitely did think about going to law school while I was doing the internship. I also realized that that was 3 more years of school after just doing another 3 years of school. So, it's not off the table,
Hmm.
but it's potentially a back burner idea.
Interesting. A lot of pre-meds, they think about going to med school. They don't do that right away. Sometimes they consider law school. Sometimes they consider getting a DRPH or a PhD. It does seem kind of like an interesting pattern with pre-meds. I was pre-med as well myself, so I always like to ask what people's long-term aspirations are, because I always find that they're quite education intensive. After that, you did the finance intern at the ACHE. Not a lot of people know about the ACHE, or they know about the ACHE, but they don't know about their internships. So, how did you find the internship, and what was it like?
Yeah, so there are many chapters of ACHE around the country. In Tampa, Florida, where the University of South Florida is, it's the Western Florida chapter. And so while I was a student, I was kind of looking for opportunities to do something different. Now that I had done a lot of compliance during my actual like school internship, I realized, we're learning all this about finance. I've learned like financial accounting and managerial accounting in undergrad, but I don't feel like I actually know how to apply that knowledge. So one of my mentors was actually very involved in the chapter of ACHE, and he was a professor in our school. So I had asked him, I really want to do something more with this, knowledge that I've learned in school in theory, and really kind of apply it somewhere. So he connected me with the regent and the president of ACHE Western Florida chapter, and they had these two internships. So they had a programming and events intern and a finance intern. And so I thought it'd be a great fit if I was able to apply. So I did. And I spent a year with them, actually working very closely with their treasurer and doing kind of all of the finance and budgeting for that chapter, which, that all the in-person events happen, all the like membership dues come in. I don't know if everyone knows this, but ACHE actually gets money from the national chapter to
Hmm.
fund the local chapters and vice versa. So it was a very cool mix of, funds flowing in and out of the organization, but also having to kind of budget and plan for the events that they do throw annually. So it was a very interesting
Excellent.
internship. I learned a lot.
And it's an important skill to have. I was talking with the COO of Temple, and he said, the two things you got to have to run a hospital, you got to have that, really good leadership, but you got to have budgeting. He goes, you got to know how to do finance, got to know how to make a balanced budget, because it's going to be throughout your whole career. And he said to me, he said, if you can balance a $500 budget, you can balance a $500 million budget. And I said,
Exactly.
okay. So I still haven't cracked that piece yet. I haven't really cracked either, but I'm working on it. So I think that was a really good internship to have. One thing I noticed that it looked like you were doing between, over all these internships is being a research assistant at Moffitt Cancer Center.
Mhm.
Why were you, a research assistant there? And do you have a personal connection with cancer? Where did you get that research assistantship? What was that about?
Absolutely. So I do have a personal connection with cancer. That's something that's very near and dear to our family's heart. We have always kind of donated and been involved with breast cancer awareness. My mother and my great grandmother both had breast cancer. My mother is very healthy now. So we're very excited about that. But while I was at Moffitt and growing up, we did a lot of fundraising. We did a lot of, events with breast cancer survivors, and we volunteered in a lot of the hospitals and like the cancer care clinics and things like that. So when I got to the University of South Florida, Moffitt Cancer Center is actually located in the heart of their university. So one of my first projects I remember was we had to do a business plan, and we had to base it off of an institution, and I had picked Moffitt. And part of our business plan was to actually go to the company organization that we had chosen and interview someone who is in a senior leadership position. So I had gone and I met with I believe her title was the Director of Population Sciences.
Hmm.
So population sciences is the not clinical research portion of their research institute. And so I met with her and we had a phenomenal conversation about my project. And towards the end of my project, she asked me, she was like, we hire a lot of USF students. I'm not sure if that's something you're interested in, but we have, research assistant positions. We work with the students a lot. So we're very accommodating to student schedules. And coming straight into grad school, this is like my first semester. I want to say it was like October or November. So I had just started. I didn't know anyone in Tampa yet. I was like, I don't have a job. So maybe this would be a great opportunity. So I did apply and I ended up working in a lab with a researcher. And I very quickly found out I was doing surveys. I absolutely suck at folding papers and putting them in an envelope. Horrible.
I had a similar experience when I was doing fit. Are you familiar with fit kits? The
Yes.
fecal immunochemical, yeah. The You have to fold the notes and slide it in, and it was so funny because I was new at the time, right?
Mhm.
And I was the youngest person on the team, and they had one of the older nurses. She's not older; she's in her 40s. More experienced nurses looking at me, and I was like messing around with the paper, and she's just like, "Oh, this new generation doesn't know how to mail out envelopes."
Yes, exactly. That's what they were telling me too. They were like, "Wow, we can't believe you don't know how to fold an envelope."
Yeah.
And I was like, this is embarrassing now. But lucky for me or unlucky for me, I don't know. COVID happened very quickly right after I got that job. So all of the actual research that was happening in the building was on pause. I came home and there was no more folding papers. I was getting so many paper cuts. It was a mess. But the same director I had interviewed, yeah, called me one day and she was like, "Hey, we have a job that's not folding envelopes. Would you potentially be interested?" And I was kind of like, "Yeah, yes, like anything to get me out of mailing letters." And the job was actually compiling all of the IRB accepted and approved research studies that Moffitt does. So, mind you, these are like hundreds and hundreds from every single PI, coordinating it all together, and then creating a packet to then send to their COVID response force, is what they called it. So, it was a group of executives who were coming together to go through every single research study that Moffitt was doing and determine if that study had to be resubmitted to an IRB to get new approval because we were implementing safety precautions and if that would change the actual study design. So she was like, "Yeah, can you do this?" And I was like, "Absolutely. I will do anything you ask that is not letters and envelopes."
Nice.
So that's actually how I transitioned. And from there, they just kind of kept giving me opportunities as they came up. And I kind of just never said no. So I learned so much. I've done so much within research with them. That director is still one of my mentors, and I will never forget how much she believed in me after she saw my horrible origami skills.
So really, never say no is good advice then.
Yeah, definitely. I think that would be like my one big thing is I never say no.
Hmm. What I want to kind of understand as well before I ask you some more questions is when it came to a fellowship, you probably could have gotten a job without a fellowship with all of your experiences. Was the fellowship required or was that something that you chose to do?
So the fellowship is something I chose to do. Out of my graduating class, I think I am the only student that year who chose to apply and got a fellowship.
So I want to ask, how many fellowships did you apply to? And was Dana Farber your top choice?
Yeah, so I will preface this by saying I'm an extremely competitive person. A lot of times I'm an extremely competitive person against myself. So I told myself, you're going to get a fellowship. And that's what I wanted to do. I knew I didn't know what I actually wanted to do in a hospital. I knew I wanted to be in a hospital. And so I applied to like 35.
Wow.
Yeah, it was a lot. I do not recommend for everyone to apply to that many, but I told myself, like, I will get one. So I applied to a lot. I, worked for almost a full year on my application, really made sure it was perfect. And then I had a short list of like the top like 8 institutes or hospitals that I really was interested in. So Dana Farber was definitely in the top. It was also the only cancer center that I applied to, and it was kind of my
That's
like soft
surprising.
spot. Yeah.
I thought that you would have applied for like more, or at least, especially in the top, would have been mostly cancer centers based on your research experience, your family experience. Was there a reason why you didn't apply for more of those?
Honestly, there's not that many fellowships in cancer centers. There's a couple in some of the ones that the big names that you hear, like MD Anderson, Mayo Clinic, uh, Dana Farber. But outside of those, I didn't really know if there was a lot of other fellowships. But I also didn't know, do I only want to do cancer care for the rest of my life, or do I really want to expand and learn, you know, general hospital, like acute hospital operations? And so that's kind of why I had a mix of the two. But this was the only cancer focused institute that was on my list. It was really a soft spot in my heart, and I loved their mission. So,
I think it's good that you're giving us this feedback because most apply for between 12 and 15.
mhm,
But the issue with that is that they're applying for 12 and 15, usually that they have ties to. And so the ones that they get accepted to are the ones that they have tied, like they've worked with people who work
yeah.
there or they've been a patient there for forever or X, Y, or Z. And so their application is a lot more compelling. So I think when you apply for 35, it helps us get kind of a broad overview of how many fellowships there are, which is not that many, like you're saying, compared to the amount of fellows, which is huge.
Mhm.
Do you think you got into Dana Farber because your story and your application to them was especially compelling?
I like to think so. I know in my personal statement, I did go very personal with my family history about cancer care, but also kind of my first glimpse into healthcare administration was when I was in the hospital, not at Dana Farber, but I was at a children's hospital when I was younger, and I had, I think, scarlet fever, but I was in the hospital maybe one night. I remember there were so many doctors and nurses, and I was like, this is so cool. Like, they're all fussing over me. Like, I am the princess. Then I remember the food was terrible. My dad went and got me onion rings from Burger King. That was my favorite thing when I was little. And, as a healthy parent, you weren't allowed to eat those all the time, but I was in the hospital, so I got all the onion rings I wanted. And then I vividly remember there was this one woman who came in who looked so out of place. And she had like the most fabulous suit, and she had heels, and she was wearing makeup. And, as a young girl, I saw her and I was like, wow, like I want to be like that. Like I want to be a, business woman the way she is. I want to be a boss. Like I want to look so good. I had no idea what she was doing. Absolutely none. I know she talked to my parents. I know my parents were like, wow, this is phenomenal. Thank you. We understand what's happening now. And then I never saw her again.
Wow.
And so I remember while I was in the hospital talking to all the nurses and the doctors and the clinicians who are coming in. But then like, thinking back, what I really remember was the woman.
Hmm.
And yeah, so when I was applying, I knew I wanted to be that woman for someone else.
Wow, nice. That is awesome. Well, good. That's a
Yeah.
great experience. So, excellent. And so you submitted these applications. You wrote this incredible application. And how many did you actually decide to go and interview with?
So I think I got like 22-ish first round interviews of the 35. Some of them, you know, at this point the application cycle is very short. The turnaround time is very quick. So I didn't hear back from a lot of the places that I had applied to, or I did a first round interview and then very quickly I heard like, thank you so much. You're phenomenal. You are not our person, which is hard to hear, but also kind of understandable. Like they're interviewing so many people.
So it's a little scary at the time. There's a little bit of
Yeah.
anxiety going on. Yeah.
Oh man. That month. So The interview process happens from the first week or the first Friday of October to about the first Friday of November is that like interview period. So that the application cycle closes that first Friday of October. And then you know where you're going by, like first or second week of November. So in that point of time, I was a mess. I was an absolute mess. It was my birthday month.
Mm.
I'm a Hindu, so we have a lot of holidays that happen in the month. um, Hindu New Year was happening during that time. So I was going back home for Diwali and like celebrating with my family. I was all over the place. And then I was, flying out to different cities from different cities for these interviews. So it was a very hard time. I will admit, I do not recommend that for everyone.
Yeah.
I also tell people, make sure you prioritize your health during this time
Yeah.
because I did get really sick just from the exhaustion of it all.
Wow.
Mhm.
That is, yeah, that's seriously very, very impressive that you did all of that. And like I said, I think pre-meds too, they had this like expectation, I think, that they set for themselves of like this crazy like medical school, which is like super like unbelievable. It's like such a hard, like so many people are burnt out after medical school. And so I do see a lot of people doing like these really, impressive things. So that's truly impressive. And then why did you, I assume you had a few choices to choose from, like you said, there was six there. Why did you go with Dana Farber?
So, a big thing for me was the leadership I would be working with, but also the culture and, the values of the organization. So, one of my like first questions that I ask in every interview is like, what was your first impression of your institute once you joined or your hospital, your organization for any job? And I think it catches people a little bit off guard when you ask like what was your first impression, but it gives you a very good understanding of what kind of culture you're walking into. The second thing I like to ask is what kind of mentorship opportunities and kind of leadership development opportunities do they have? So I asked everyone, a lot of people had very good answers. But as I said earlier, Dana Farber really had it was that spot in my heart. So when I had asked that, I was talking to my preceptor who was interviewing me at the time. And I remember she's just such an amazing, passionate, driven leader. And so I knew at the end of the day, of the places that I had gotten into, I think this is the leader that I want to work under and I want to learn under. And this is the person whose, you know, hand I want in the development of me and my career and my life.
Wow.
Mhm.
And so has it turned out well for you, that decision? Have you
Oh,
enjoyed the
yeah.
past year or so?
I have, yeah. Actually, I am a 2 year fellow. So
Okay.
one of the other perks of my fellowship or it was at the time that I applied, a 2 year fellowship. They did extend it from their traditional 1 year fellowship during the pandemic and a little bit post pandemic to really give fellows the time to learn and grow as much as they possibly can during this weird, phase. Because it's odd to not be in the hospital or in the institute. So currently I'm actually in my office in the hospital, which is phenomenal to be back here.
Mm.
But yes, I'm one of the first 2 year fellows, and I'm coming up at the end of my second year, and I've loved every second of it. I've done so many cool projects. I've worked with so many leaders here and just in the Boston area. I went to ACHE this year. Everyone knows Dana Farber, so it's very cool to see.
Yep.
Mhm.
Absolutely. Wow. I love to hear that. Love to hear fellows enjoying their experiences. I want to ask what is one of the favorite projects that you've done so far?
Absolutely. So I've worked on a lot of different projects, kind of in different areas. I've worked in finance. We worked on our operating and our capital budget for the year. So really closing out our budget, which was a phenomenal experience for me to learn kind of real world, that 500 million budget.
Yep.
Um, because I could do the $500, but I never really implemented that into the big budget, but now I did. I worked with strategy, so I worked on a lot of improvement initiatives. But I think one of my favorites was I worked in our ambulatory clinical operations department. So that's under our like traditional operations. Since we are an outpatient facility with no hospital per se, all of our clinics are outpatient clinics. And so I was actually able to work in our breast and hematology clinic to implement a pilot program because a lot of our patients who are coming in who get doctor's orders for, you know, 7 days of treatment were
Mm.
not getting those. They would have to get their, order every day signed for infusion. And it's really hard to find a doctor who's, in patient rooms, who's running around, who's, in meetings to sign a patient's chart. So I was able to implement a pilot program to actually have all of that done beforehand so that when our patients actually showed up at our clinic ready for, infusion, which is already in and of itself a long process, they didn't have to wait. And so everything was done beforehand. Everything was kind of sorted and settled just to make the patient experience as easy as possible.
Nice. Wow.
Mhm.
Incredible projects. So
Thank you.
with real world impact, it's what like serious
Yeah.
wow, real world impact, excuse me. So that's a wow, wonderful, wonderful. So two of the last questions for you. The first is, what do you plan on doing after you're from Florida? You're up in Boston. What does that look like? Are you looking to stay at Dana Farber, or are you looking to move back to Florida? What is it looking like for you?
I feel like eventually I would love to move back to Florida. I am a Floridian through and through. However, New England is really capturing my heart. So at this point in time, I'm not entirely sure. I am looking for opportunities kind of everywhere, a little bit following the mentality I had before of kind of applying as many places as I can. But intentionally, I would love to stay at Dana Farber. And I think if we find a position that matches, I will stay. And if I find something that, piques my interest, if I can learn a little bit more somewhere else, I might go there. I am very curious on how does cancer care in acute care hospitals differ from cancer specialty hospitals.
Mm,
So potentially, let's see what might be brewing.
yeah. Would be a good learning experience there then
Mhm.
for sure. Excellent. Wow. Yeah. I mean, I'm a big New England fan. I love New England. I love the Northeast in general.
Me
So,
too.
my vote is always to stay in the Boston, Connecticut area. But Florida definitely is very different, and your family's there. So my
Mhm.
wife spent a lot of time in Florida, and so I can definitely get that Florida calls. A lot of people down in that area.
Yeah, we have some great hospitals and health systems down in Florida, but I
Absolutely.
feel like my parents are there. Like, it's always going to be home. So at this point in my life, why not explore everywhere else?
Of course, and you can't beat Boston's hospitals.
I-
I mean,
yeah,
I know that their rankings fluctuate throughout the year, but for me, MGH will always be the best hospital in the world for me at least.
no, it's a
So
phenomenal opportunity to work very closely with MGH.
yeah, I know that's one of the great things too, the partnerships in the city
Mhm.
and kind of throughout the Northeast. There's so many great
Yeah,
partnerships. Last question for you. Appreciate your time and spending extra time as well with me.
absolutely. Sorry, I
What
talk a lot.
No, this is excellent. I've loved listening to it all. I'll edit my own meanderings out of the video a little bit. But
Look, you can edit my meanderings out too.
oh
Don't
no,
worry.
it's great. It's great. So last question. What do you recommend for people like myself earlier on in their career who, how can we be as successful as you've been?
Well, I guess I've kind of sprinkled all the advice I had throughout this interview, but definitely never say no to opportunities. You never know where they're going to come from. I want to be like not so cliche with my
It's
with
all
my
right. I mean, it's good. It's good for people to hear. I think sometimes the same things like
yeah.
over and over again. I mean, you talked about earlier identifying mentors, never saying
Mhm.
no. You didn't burn bridges either when you left organizations. I think that's really
Yeah.
important. So I think overall, that's the never say no is excellent advice.
Yeah. One more. This is actually something I said in my ACHE panel a couple weeks ago. But make sure that when you're communicating with people, you're really, as much as you think that, yeah, I'm a good communicator, make sure your expectations are clear in every position in your life. Make sure that you can communicate clearly what you need and what they need. And that's one of the ways that I haven't been able to, burn bridges anywhere I'm going. I'm able to maintain all of those mentors that I have met throughout my career that still work with me and shape me and are invested in my growth. That's the way you kind of cultivate your network, which is huge. healthcare is like the tiniest of industries, even though it's so large.
Hmm.
Everyone knows everyone. And if they don't know anyone, they'll know someone who knows you.
Yeah.
So, yeah, we heard a story like last weekend from one of our panelists, and he said that he heard a story from someone else who had spoken badly about an executive at one of the hospitals they were working on, like kind of gossiping, and turns out the person he was gossiping to, it was his wife.
That's
And
funny. Oh my
I
goodness.
have never seen a room like pin drop silent. Every single jaw was on the floor, and I was like,
Wow.
wow. So the
That's
advice
rough.
that
That's
right,
pretty rough.
it
Wow.
was
That's, yeah.
horrible. So the advice I
And
learned from that was
that's,
don't talk bad about people. Healthcare is tiny.
and that is a crazy thing is it is a very much smaller community than I thought coming into it, especially at
Right.
the corporate level. There's really not that many people.
Mhm.
But thank you so much for joining us. A wonderful conversation. I really enjoyed talking with you. Hopefully, we can talk with you again once you go on to your next stage of your journey.
Absolutely. I would love to. Thank you again for taking the time and for reaching out to, hear my story.